Good afternoon and welcome to today's webinar entitled Transforming Healthcare and Improving Patient Care in the Greater Philadelphia Region. My name is Rhonda Dodson and I am the Director of Pennsylvania REACH, the Regional Extension Center for PA. On behalf of Pennsylvania REACH, I want to thank you for joining us today to learn more about the services available from HealthShare Exchange of Southeastern PA. But before we get started, I do want to go over a few housekeeping items. First, all participant lines have been muted and will remain muted during the presentation. However, there will be a Q&A session following the presentation, at which time the lines will be unmuted. If you have a question that comes to mind during the presentation, please type it in the chat feature and we will be sure to address it during the Q&A session. Please note that this webinar is being recorded and will be posted on the PA REACH website at www.pareacheast.org later this week. We know that many of you participating in this webinar today have been working hard over the past few years to meet Stage 1 and now Stage 2 meaningful use measures. The issue of interoperability and the exchange of information has often been a great barrier. We are pleased today to invite Jennifer Natale and Pam Clarke with HealthShare Exchange of Southeastern PA to share their services. They do have their bios on their slides, but I'd just like to give a brief presentation. Jennifer is the Senior Manager of Engagement and Adoption at HSX. She has substantial experience in healthcare services delivery as an administrator. Jennifer brings an understanding of provider organizations and of change management within this industry to her role in direct support of user uptake of HSX services. Pam Clarke is the Senior Director of Member Services and Policy and the Chief Privacy Officer. Pam has extensive experience working with, for, and on behalf of health systems and collaborating with healthcare insurers. At HSX, she serves both of these industry segments equally in her lead role for member recruitment and retention. Pam is also responsible for user engagement and adoption for HSX. So we welcome you ladies today and we'll turn the presentation over to you.
Thank you for that introduction, and thanks to everyone for participating in this WebEx. HealthShare Exchange is a nonprofit health information exchange organization that primarily serves the Greater Philadelphia region. It was established back in 2012, and our mission is really to support the triple aim. So to support increased access to services for patient quality care and to help decrease the cost of healthcare delivery. Our vision is to build a trusted community of healthcare stakeholders that would collaborate to help deliver better healthcare to the patients that we serve. Some of what we decided we wanted to focus on in terms of health information exchange was to help to solve critical health problems in the region. The establishment of HealthShare Exchange really was born out of a project that was done by the Healthcare Improvement Foundation in the region back in 2010. And the Healthcare Improvement Foundation did a project that focused on preventing avoidable episodes. This was focused on trying to prevent any readmissions that could be avoided. Needless to say, this would help decrease healthcare costs and provide improved quality to patients. One of the committees that I participated on in this project focused on communication from the hospitals to the health plans. And it became clear that the health plans in the region didn't always know when a patient was being discharged from the hospital. Likewise, although hospitals send discharge summaries to primary care physicians, those summaries do not always get sent in a timely fashion. So HealthShare Exchange decided that we would try and improve care transitions, focusing first on discharges. So our particular program has been designed to focus on sending information from the hospitals to primary care physicians, outpatient practices, to help those practices know what services were delivered by the hospital and that information would be sent between 8 to 12 hours of discharge. And Jennifer will talk in a little more detail about that particular use case. But essentially, what we're trying to address is that sometimes the handoff from inpatient to outpatient is not well coordinated, and we're trying to assist in improving that. Likewise, sometimes the hospital does not know who the primary care physician is at the time that a patient is admitted to the hospital. So we have a special enhanced service that allows us to determine who that primary care physician is, so that when a patient is discharged, that discharge information can be routed to the right primary care office. As I already mentioned, often there is a delay in the hospitals getting that discharge summary to the outpatient practices, and we would be making it more efficient for that to occur. So hopefully we would improve care because there would be less likely to be mixed up information or errors or delays in care. We have another use case that is not focused on discharges, but is focused on when patients come to the emergency department. And Jennifer will talk in more detail about how we are trying to help ED physicians obtain information in a timely fashion so that they would know more about the patient so that they could focus their treatment. HealthShare Exchange was established with letters of commitment from 37 acute care hospitals in the region and 3 health plans. The 3 health plans that participate with HealthShare Exchange are AmeriHealth Caritas, Health Partners Plans, and Independence Blue Cross. From the plan side, that means that HealthShare Exchange has participation on behalf of 62% of the covered lives in the region. From the hospital side, 37 acute care hospitals represent 93% of emergency department visits in southeastern Pennsylvania. We are defining southeastern Pennsylvania as the 5-county region, Philadelphia and the 4 suburban counties that surround Philadelphia. This past year, we obtained letters of commitment from 2 behavioral health facilities, Eagleville Hospital and Elwyn Institute. We are working on a pilot to exchange information on behalf of these behavioral health facilities, in addition to the sharing of information among the medical facilities and the health plan members. We have on our roadmap a plan to expand our reach beyond acute care facilities and primary care physician offices to include specialist offices and to include entities across the continuum of care, so that in the next year we hope to bring on board nursing home facilities, federally qualified health centers. Hopefully we will be able to connect even beyond the 5-county region to other health information exchanges in other parts of Pennsylvania and in other states, the ones that are contiguous to our region, namely New Jersey and Delaware, as our first priority. In Pennsylvania, HealthShare Exchange is one of 9 health information exchanges, so we will be working on exchanging data with some of those other Pennsylvania health information exchanges. We're proud to say that in 2013 was the first time that we actually were successful in exchanging data between Crozier Keystone Health System and the University of Pennsylvania Health System. We are exchanging data through what is called direct. That's a technology that is used to send information in a secure fashion from one entity to the other. So our first exchange of data was literally on New Year's Eve of 2013, and it was information shared between 2 different health systems in the region. In addition, In 2013, our governance was established. Our governance is made up of 15 board members, 5 health plan representatives, although we have 2 open seats. As I already mentioned, we currently have 3 health plans that participate with us. We continue to recruit and try and engage other plans that are active in our region. We have 5 hospital seats on our board and 5 at-large seats. HealthShare Exchange has been a 3-time grant recipient. We were successful in securing grant dollars from the federal government, also from Centers for Medicare and Medicaid Services through the Pennsylvania Department of Public Welfare. We were successful in securing a specific regional grant for Health Information Exchange, which is very unique across the country. We have a communications grant for consumer education, and if you go to our website, which is www.hsxcepa.org, you can find our video that tells more information about what we are doing, and it is called our explainer video. So it's geared toward consumers so they can understand what Health Information Exchange is. One of our other early adopters is the Children's Hospital of Philadelphia.
All right. Good afternoon, everybody. As Pam mentioned, we first wanted to highlight 2 of our use cases that address challenges related to transitions in care. And these 2 use cases are most applicable to primary care practices. As Pam also mentioned, both of these use cases employ direct technology, which is a point-to-point communication that can be compared to encrypted secure email. The first use case is discharge information that is currently in production now, and this allows for timely communication after discharge to a patient's primary care provider using direct secure messaging. So when a patient is discharged from an HSX member hospital, a discharge continuity of care document, or a CCD, is sent from the hospital to the patient's primary care provider. And as Pam mentioned, the target time frame for this sending of the CCD is 8 to 12 hours post-discharge. We also have something called Enhanced Direct that leverages a payer database to assist with identifying primary care providers for patients. So if the patient is a member of one of the 3 health plans that participates with HSX, so Independence Blue Cross, AmeriHealth Caritas, or Health Partners plans, then the HSX Automated Care Team Finder, otherwise known as ACTF, can be employed, where HSX will check with the patient's health plan to determine who his or her PCP is, and then we'll be able to pass the discharge CCD along to this person or practice. And again, we refer to services like ACTF as Enhanced Direct. The second use case that's coming to our membership and participants in 2015 is called Encounter Notification Services, where by subscription, a list of real-time patient encounters will be sent to participants using direct secure messaging. And participants will be able to choose how often they receive these messages and the workflow they will use to receive the list. Other health information exchanges have been very successful in their offering of encounter notification services, and we hope to experience the same here as well. Related to the discharge information use case, here are some required data elements and optional data elements that we have as part of the discharge CCD. These elements are closely aligned with Meaningful Use Stage 2. We're working closely with our hospital members to ensure that the discharge information CCDs are as complete as possible and available within the short time frame post-discharge. But we do acknowledge that there are differences between the CCDs that are sent between our HSX member hospitals. We are actively working to understand these differences and make suggestions for improvement as appropriate. Here is an example of an encounter notification summary that subscribing HSX participants are able to receive. Again, subscribers have the ability to be notified about emergency department and inpatient admissions and discharges. To subscribe, HSX participants currently need to submit a list of their active patients using a template that we provide. And we define active patients as those individuals who have been seen within the past 18 months by a provider. And now I'm going to turn it back over to Pam.
One of the things we wanted to make sure that you understand is that Pennsylvania is what is called an opt-out state. In 2012, Act 121 was passed by the Pennsylvania legislature. In that law, it determined that the state had to establish a mechanism for consumers to be able to opt out of having their clinical information shared through an electronic means, such as Health Information Exchange. HSX has agreed in our trusted community to also use an opt-out process. We will try to leverage the system that the state will have in place for this. The specific use case that Jennifer described, which is in production, the discharge information use case, follows the HIPAA requirements because we are sending that information for treatment purposes. Currently, HSX has business associate agreements with our participants who are sharing data, and the business associate agreements allows information to be shared in accordance with HIPAA, so that would be for treatment, payment, or operation purposes. When HealthShare Exchange moves to share data through encounter notification services or query-based services, we will be mindful of the fact that patients need to have an opt-out mechanism for those services. And as I mentioned, we will be leveraging the state's system for that in 2015. In addition to just general opt-out, there are special populations that have special legal requirements tied to whether their information can be shared. In Pennsylvania, the three super protected categories are mental health treatment, alcohol and drug treatment, and HIV/AIDS status information. In these three categories, there are certain circumstances whereby patients must consent before their information can be shared. As I mentioned earlier, HSX is working with 2 of our member hospitals to work through some of these details in how patient consent would be obtained and information could be shared in a legally responsible manner. The other thing that we want to make sure that our participants know is that they are required to communicate to their patients that they participate in a health information exchange. In general, most groups, clinical groups, hospitals, physician practices would have a notice of patient practice, privacy practice, that they share with their patients and have their patients sign. HSX recommends that that be the vehicle for communicating to patients when you are participating with HSX through the Health Information Exchange. We have template language that we share with our participants that they can incorporate into their already established HIPAA notice of patient practices so that it makes it easier for them to communicate with their patients that, in fact, information may be shared electronically as an entity participates with HSX. If patients decide that they want to opt out of having their information shared, then they would be responsible for completing and submitting opt-out forms that would be available for such purpose.
So what does it take to participate with HealthShare Exchange? If you are part of a hospital-owned practice, the fee to participate is covered by our member hospital or health system. We understand this covers approximately 60% of providers in the 5-county area. If you are an independent practice, there is no fee to participate with HealthShare Exchange for direct secure messaging. In order to send and receive direct messages, you can participate using your electronic health record that must be a direct-enabled version, or you are also able to participate using a web-based platform that we, HealthShare Exchange, are able to provide to users in your practice. So just to reiterate, there are many benefits for primary care providers participating in HealthShare Exchange. In 2015, you'll be able to receive encounter notifications when your patients are admitted or discharged from a member hospital's inpatient unit or emergency department. Now, by participating, you'll be able to receive timely discharge information about your patients. Third, as we collect direct addresses from hospital members and independent practices around the 5-county area and beyond, we're building a master provider directory, or a white pages of sorts, which we're able to send back to you for importing into your electronic health record, so you have the ability to communicate electronically with peer providers using direct secure messaging. If you're interested in participating with HealthShare Exchange or want more information, my contact information is available on this slide, so please feel free to send me an email or give me a call. And you can also find out if your EHR is direct enabled and if you or your colleagues already have direct addresses, even if you're not using them. Thank you for joining us today and taking the time to learn more about HealthShare Exchange, and we'll take questions if you have them.
Yes, thank you, Pamela and Jennifer. At this time, we're going to unmute the participant lines and begin the Q&A portion of the webinar. If you have any questions pertaining to the presentation, please feel free to ask them now. If you have posted a question via the chat feature, those questions will also be addressed during this session. The lines are now unmuted. Okay, Rhonda, it looks like we don't have any questions. If you'd like to wrap up the session.
I did have one question. My name is Lisa.
Sure, go ahead, Lisa.
Our EHR utilizes direct messaging, and for our providers, is that the secure messaging platform that you guys use?
Correct.
So what practice are you from, Lisa?
Tri-County Pediatrics.
And what's your EMR that you use?
It's from Greenway or Vitera. It's called Intergy.
Yep, I'm familiar.
Okay. So if we wanted to learn more about your services, do I send an email or you'll give me a shout out, or how does that work?
If you want to email me at the email address in the slide deck, I'll put that back up. You can see it right in front of you, and we can start the conversation. That'd be great. We actually are working with another practice currently who has Greenway, so we're actively in the midst of working through things with them.
Okay, sounds good.
Wonderful.
Thanks so much, guys.
This is Pam Clarke, and one thing I'd like to add that we didn't address in the presentation is that we have a financial sustainability model where we have subscription fees paid by our health plans and our hospital members. And there was a principle that was established by our board that we would not charge physician practices for connecting with us for the direct service. And I think that's an important consideration, so that in order for ambulatory practices to become a direct participant with HealthShare Exchange, there is no subscription fee involved at this time. Now, there might be costs associated with what you might need to do on your end to connect, but in terms of connecting and being able to receive direct messages from our hospital members or from other practices that are connected with us through direct, there would be no charge. We do have a contracting mechanism so that we have, as I already mentioned, a business associate agreement that would need to be executed, and we have a direct participation agreement that would need to be executed. But to date, that has not really been a stumbling block for entities to engage with us. So I just wanted to mention that those steps would be part of the process for physician practices to engage with us. Other questions or comments?
Ladies, there was another question submitted via the chat, and the question asks, how soon do you expect transmissions to start?
So actually, we have messages that are already flowing, and we started message connectivity in live production, as I mentioned, back in 2013, but really ramped up in June of 2014. And I think that our message count at that time was in the 200s, and then it rose up to close to 5,000 messages in September, and we continue to have a high message volume as we go forward. So we already are exchanging messages between our members.
And as more members are onboarded and go live with us, obviously we would see that number increase. And then in speaking with audiences like this today, we're looking to get the ambulatory community connected as well, because related to the discharge information use case in particular, we want as many patients who are discharged from an ED or an inpatient unit we want that information to actually go to a provider, and that means that that provider has to have a direct address, whether it's provisioned by us, HealthShare Exchange, or it's something that they already have within their own EHR.
We had another question in the chat feature. It asks, MLHS private physicians with eClinicalWorks were told MLHS and you were working together to integrate us. Where are you with that?
Yeah, so that's a great question, and we do understand that ECW in particular is very widespread around this region. We actually have, with our legal counsel right now, ECW's HISP agreement that needs to be executed in order for us to, in effect, trust each other so that messages can flow once those practices are connected through HealthShare Exchange. So we know that that's high priority. And we are actively making sure that that gets done as soon as possible.
I expect that that will probably happen in terms of the HISP-to-HISP connectivity in early 2015, the January timeframe.
And we have another question. It asks, if an organization has multiple practice locations that straddle the 5-county boundary for the exchange, will only those locations within the boundary be able to participate in the exchange?
No, actually, as I mentioned, we are very much interested in expanding our borders beyond the 5-county region. And so if we were working with a particular practice that had practices across the state lines or in other counties beyond the 5-county region, that would not be an excluded practice. We would include any of the practices that were part of the larger organization. We appreciate the questions. The dialogue is really helpful to us, so any other questions are welcome.
There is one more question. Do we need, and this might be a typo, BAAW, both the practice and the EHR vendor? We use Care 360.
Is the question needing a BAA? I'm sorry, I had a hard time hearing you.
It was entered into the chat. do need BAA with both the practice and the EHR vendor. We use Care 360.
We do not currently need a business associate agreement with the EHR vendor. We only need it between HSX and the practice.
So as Jennifer mentioned, she's the primary contact for ambulatory services for HealthShare Exchange, and she's open to receiving additional questions or comments from any of you that are participating this afternoon. We also do presentations for offices and would welcome the opportunity to come to speak to your physician groups if you think that that would be helpful. It was already mentioned about Mainline Health System, and we did a presentation for their physician practices, and we are happy to do that for any ambulatory service groups that would be interested. So feel free to contact us about that.
Okay, I think we've addressed all the questions that have been entered in the Q&A function. If anyone else has a question, please feel free to ask it now.
Okay, hearing no questions, we'll go ahead and wrap up. I want to thank again Pam and Jennifer for taking the time to share this information with us today. It was very valuable. And as we've stated many times, please, if you have additional questions, please feel free to reach out and contact Jennifer directly, or if you are unable to reach her for some reason, please feel free to contact PA Reach, your coordinator. We can get you in touch with them. I wanted to let you know there will be a brief survey at the end of today's session, and we ask that you take a moment to provide us with some feedback about today's presentation. Thanks again for joining us, and have a great day, everyone. Thank you.